Hi, my name is Stephon Moise. I'm doing a orthopedic residency at Advent Health, Orlando. I initially was interested in athletic training. In high school, I took an athletic training course, and I was interested in athletic training because I had a large background playing soccer, and I was really into anatomy at the time, and I thought it was really interesting how injuries and the human body was kind of connected in that way. And so I pursued that in high school. And once I started pursuing athletic training a little bit more with more detail, I found out about physical therapy because athletic trainers are involved in rehab. And the rehabilitation aspect was something that was a little bit more interesting to me versus on-field management of athletes. So that's when I decided to look more into physical therapy and pursue that going into college. When I was initially looking into applying for residency and going for a specialization, I was thinking about the pros and cons of doing a residency versus practicing for a number of years and then taking the specialization exam. And one of the things that I really wanted to focus on was getting that mentorship and networking with other physical therapists just to improve my skills interprofessionally and then also get good feedback as far as my practice goes. So it was interesting to look through those options. And for me, it was more important to have that network and to really feel like I was part of something bigger than myself versus just kind of going it the lone route and not really having a lot of guidance. I finished my DPT at the University of Central Florida. I graduated last year in May, so I started working officially as a PT in August of 2021. And I decided to go for a residency because I really wanted to get that aspect of mentorship that would help me to advance my practice in a more meaningful way. I was used to reading things in school in a textbook and kind of doing my own research, but I think it's a lot different when you can sit down with someone and have them evaluate you from that third person perspective and really talk through different patient cases. So that was really helpful for me. So one of the biggest aspects I was looking for in a residency was affordability. There's different options as far as pricing and tuition with different residency programs. Some offer a reduction in salary or some require you to pay tuition. So graduating from PT school, which was a lot of financial load for me, I didn't want to necessarily increase that with going through residency programs. So one of the biggest things was affordability and then also location. So I did want to be in Florida, ideally, to stay close to family. And having that family connection and being able to access them was really good for me. So some unique opportunities. I've gotten to shadow some orthopedic physicians, which has been good to see their workflow and get an idea of how they refer patients to PT versus some of the more non-conservative options that they would like to recommend their patients for. And something that I've enjoyed so far is our weekend courses. So every month we have modules that go through specific areas of the body, and we talk about upcoming research and different techniques that we can use to improve our care with patients. So that's been really helpful for me to just kind of get up to date with everything and practice my skills again. The most challenging aspects, I think, are being able to take feedback and incorporate new things into your practice. I think it can get very easy to get into a habit of doing the same things, especially when you get into an everyday workflow and you're just focused on maybe trying to get your documentation done or making sure that you're not overextending yourself. But it's been really helpful for me to get that feedback and start incorporating it. So some advice I would give to a physical therapy student looking to go into a residency program is to really do your research. For me, I kind of treated it as the same process I used when I was applying for PT school. So looking at location, looking at price, looking at the different aspects of their program and how exactly it's going to help you going forward. I think it's super important to know exactly what you're getting into because it is such a big investment. So I would advise all the students or even current physical therapists to really do their research. And good qualities of a resident are, I think, being able to take feedback in a non-defensive manner and being committed to continuing your learning and education. So for application and interview process, you do want to make sure that you have a good idea of what that residency program is all about. That's going to help you to make those connections with the people who are interviewing you. And remembering that the interview process is not only for them, but it's also for you. So ask all the questions that you want to ask. You're not always going to get all the information that you need just browsing websites and looking at these residency programs on paper. So it's very important to ask the questions that you want to ask and make sure that you're prepared for any questions that they might ask as far as what are the things that they're looking for and particularly what aspects of their program are going to be most helpful for you going forward. So I think since I've started, it hasn't been too long since I've been in school, but already I've seen kind of shift away from some more passive interventions such as like ultrasound and electrical stimulation. I think more and more therapists are trying to get away from different modalities, specifically to reduce pain. And we're looking more at function and more ways to get the patient actively involved in their own care. So whether that looks like more exercise or maybe it's taking a broader look at their nutrition and their lifestyle factors, and it's kind of brought into a more whole person centered view since I've started. So my career path after completing my residency, hopefully it looks like continuing to work in an outpatient center. Eventually, I would like to be able to work in a nonprofit organization, possibly to provide pro bono care to patients, because I was involved in a pro bono program as part of my DPT training, and that provided a lot of insight for me, and it was really valuable experience. So I do want to be able to have that impact in my community for people who don't necessarily have the access to health insurance or traditional means of getting physical therapy treatment. So the importance of workplace diversity has become more clear to me as I've worked in a setting where a lot of patients don't speak English, and I've been lucky to have some translators at times, but sometimes I have to translate myself, or I have to call in the patient's maybe caregiver or family member, and there's a huge communication barrier that can exist, and that does affect patient outcomes. And it's so important to have people from different backgrounds that can help the patient feel more comfortable and really break down those barriers that can sometimes hinder patient care. So being part of this inaugural group is a great honor for me. I think it's an amazing program to provide underprivileged or underrepresented physical therapists and physical therapy students with these resources to really advance their own practice and really network and find ways to impact the physical therapy community on a greater level. I think this is only the beginning, and we're only going to see more and more people involved in this process, and it's really beautiful to see because historically we haven't seen a lot of diversity in this field. So it's exciting to me to see that more and more people are becoming involved and aware and really trying to push it forward. So I'm truly honored to be a part of it.